Well, thanks for having me. Thanks for asking me, Marissa. My name is Sarah. I am a mom of two, which still feels weird to say, even though the second one's been here for well over a year. So I had a C-section with my first. His name is Angus. He just turned 4 this past winter. And then I was lucky enough to have a VBAC in November of 24 with my second. His name's Colum. And I will say that a lot of what I experience and what I'll share will be through the lens of being someone who lives with pre-existing diabetes. So I didn't have gestational diabetes. I've lived with type 1 since I was a freshman in high school. And so at least maybe in like the millennial and older generations, the experience of pregnancy and diabetes is shaped by the movie Steel Magnolias. So basically like, don't have a baby or you're gonna die, which we know this is not really true. And I felt pretty confident going into my pregnancy that this is what I wanted. It had been something that I had worked towards for a long time. I did not do well after I was diagnosed with my diabetes. I was a teenager, I didn't care, and really put my body in a place where it wasn't well. And there was a point in my early 20s where I thought, like, I'm probably not gonna be able to do this. And then I made it my goal. I wanna be a mom. And everything that I had done for 10 years was basically leading up to that moment of getting pregnant. And my husband and I, we got engaged at the beginning of COVID, and we're like, we don't even want a wedding, we just want a baby. I entered into this pregnancy kind of naively, even though I had done a full spectrum doula training. And so my interest, of course, because of this time of life, is with pregnancy and postpartum for people with diabetes. But I'm also interested a lot in menstrual cycles and menopause. Like I'm always so hyper fixated on that because that can really do a number with your blood sugars. But I knew, okay, I have gone through this doula training. Like maybe I don't need a doula. Maybe I can be my own doula. And I also didn't have a doula in my second pregnancy, even though I had learned in my first that I probably should have one. And I still am like, if I have another child, there will be a doula that isn't me in that room, because there's just so much going on, and you can't always turn off that part of yourself that is thinking about your blood sugars or thinking about, the risks and the benefits, and you really just have to be in the moment. But during my first pregnancy, I have diabetes complications. So I have neuropathy, I have something called gastroparesis. So that's delayed gastric emptying. So basically it's chronic nausea and vomiting. And I also at one point in my 20s had signs of retinopathy, which before I got pregnant was something that I had cleared up by like really maintaining excellent blood sugar management. And so I felt confident going into this pregnancy that I was finally in a place where I could move through it without fear of what would happen during pregnancy, what would happen to my baby, and what my options might be with delivery. Because just being someone that has a diagnosis of diabetes before you give birth or before you get pregnant already puts you into a category in the minds of these providers. And I try to remind myself and the people that I work with that they're seeing like the whole population. Just because you're someone that manages well or someone that has access to the technology, like I point to my pump here and I wear a CGM, that doesn't mean that everybody that walks through these doors does. So they're coming from this place of understanding where they see the people that aren't able to manage this well for whatever reason, and they don't know you. So for me, I knew I was going into this probably going to have to advocate for what I really wanted. And I ended up being really sick during my pregnancy the first time, and kind of the second time too. But the first time I was like Bella Swan from Twilight at the end. Like I had lost so much weight. I was like skeletal, and I just had this big pregnant belly, but everything else was just so like malnourished looking. And I had felt like I had been overlooked. Like I'm supposedly high risk and I'm supposedly needing all this extra attention, but there I was begging for fluids and being denied, even though I knew like fluids and Zofran would do me wonders. So I think that caused me to shut down a lot within that first pregnancy. And I think that colored my experience in my second pregnancy as well, reinforcing this idea that like, if I'm going to do it, I guess I'm just gonna have to do it by myself and no one's coming to save me. But I think that was an advantage with being empowered from my VBAC, knowing that like I was going to be the one to prepare. And so kind of backtracking to that first pregnancy, very sick, getting towards the end, my son was due the beginning of February, and with pre-existing diabetes, it's recommended that you are induced like no later than like 39 weeks. That's kind of the sweet spot for where they want you to be induced. So I knew it would take like an act of God to go to term or beyond 40 weeks. Like that wasn't something I was prepared to advocate for. But I also had this hope. So my little brother was born on January 25th, which is also my mom's birthday. So I had this thought, like, wouldn't it be cool if my Nana, my mother, and myself, 3 generations of women, all gave birth on this one day? So I had an appointment that day, and I was like 37 weeks or so, and I was so sick. And I'm like, aren't you going to induce me? Like, I'm crying in your office, and please help. And they were like, no, like, we're not going to induce you. The OB that I had wasn't really, actually the MFM wasn't really supportive. She sent me to a perinatal mental health clinic instead of giving me fluids. And she told me that, you know, if you're this upset right now about being so sick in pregnancy, like you're probably going to have postpartum depression, like you're not going to be a good mom, essentially was what I took away from that conversation. Like you're going to be just crying all the time. Like just, it was so unsupportive. I couldn't believe that it had happened that way. But I made it known, like, I need to be induced. I can't do this for any longer. So going into that induction, I already felt less empowered because I felt like I was being put in a position because I wasn't getting the fluids that I needed and the Zofran that I knew would fix me right up. I felt like I'm being forced to even ask for an induction earlier than I would maybe want. So we went in, I got the fluids and Zofran. Suddenly I'm feeling so much better. And everything went really well with the induction. I was progressing great. It was a little bit longer than maybe I would have liked to have been. Maybe it was like 24 to 48 hours before things really started getting there. But I think part of that was just like my exhaustion. And then I probably would have wanted to be unmedicated, but I knew, I'm like, I haven't slept well or eaten in months. Like I wasn't even able to drink water. I was like living off of like milk and Glucerna. I'm like, I think I need an epidural and I need to like get ready for what's next. I got to 10. They're like, you're looking great. It's time to push. And then suddenly all the bells and whistles are telling them like, maybe not. And I have this feeling, and I don't know if it's true or not, but it was the night of that really, really big snowstorm that we got in January of 22. That was the night he was born, was like right before that snow started. And it was like shift change time, and like I just feel like they cranked the Pitocin to get me to the end because I had already been there for so long. And I got there, and then he needed to come out really quickly. And that similar experience of like being rushed down the hallway. They said he'd be in the room. I'm talking, I'm asking, where's my husband? Nobody's talking to me. That was terrifying because I'm like, why isn't anyone at least just saying like, he'll be in here in a second or whatever? I was throwing up into my hair, which my mom had said, I always wear my hair down. Even like I've been a yoga teacher for 10 years and I teach yoga with my hair down. She's like, make sure you put your hair up because you're going to want that up. And there I am laying there getting my C-section. And I'm like, my hair is down. I didn't listen to my mom. Like, and now I'm throwing up into my hair. Like, oh no. And no one was even helping me with that. So it definitely wasn't a great scenario to be in there, but he came out. My husband ended up being there just in time. He was healthy. The recovery from the C-section was fine. Like there was nothing wrong with him, nothing wrong with me. And I felt like once he was out, like all those issues of nausea and vomiting that I had experienced for so many months was gone. Like I had pizza, I had some chicken fingers. My husband was like, I can't believe you're eating. Like I haven't seen you eat anything in so long. And so that was great. And I think that for a little while, because everything worked out so well, especially my biggest concern was, you know, would he need NICU time for low blood sugar? Even though I had excellent management, there's still always that risk. And he didn't. So I was kind of latching on to the positive outcome without really thinking about like everything that I had experienced with the C-section. And it was wonderful. I have a friend that's a doula in Seattle who has type 1, and she was like, do you want to do a birth processing with me? I know I wasn't your doula, but like I can be in this moment. And so I was able to talk through my birth, and it was in that moment that I had such a big release. And I got to experience firsthand from like the other side of the doula client relationship, like what it means to tell your story. And that's why tonight is such a great opportunity, because
we have to share, we have to talk about it, and that's how we process it, and that's how we connect, and there's this sense of shared reality and shared humanity and just things that we all go through that sometimes are unspoken and they shouldn't be. So that was great. And so I knew, like, I'm having another baby and I'm gonna have a VBAC, especially as a doula. Like, I don't mind that I had a C-section, because I'm like, I want to go through it all. Like, let me do that. Like, let it happen to me, even if bad, good, whatever, so that I can show up in this way and I can talk about these things, not just from a professional experience, but also the lived experience. So we waited at least 2 years. I was like, I don't want to give them one shred of opportunity to tell me that I can't do this. So I'm going to wait 2 years before I get pregnant, so that I have that. I can say, nope, this is one of the things that you want. 18 months to 2 years, I did it. So we did that, and I went into it like feeling really positive. I wasn't feeling very well again, but you have a toddler, life goes on, and I think he kept me busy, and I had some strategies that I took that time that I didn't follow the first time, that I knew I had regretted. Like, I know for me, like, Tums is not okay. Like, the calcium bicarbonate slows my digestion more. I took it the first time listening to these doctors, and I didn't take it the second time, and I think that helped me. But I think also looking back on that first pregnancy and the C-section experience, there were so many hurdles that I had to overcome to even not just be scheduled for a C-section. Like, my eyesight had to be top notch going into labor and delivery, so that they would even allow me to have a vaginal birth, having been someone that had previously had signs of retinopathy. He was breech for a good amount of the pregnancy. Frank's breech, so we had to do like some stuff afterwards, even with just checking for hip dysplasia and all that. So I just felt like I had already overcome so much, and that's another reason why the C-section was disappointing. So I'm like, my eyes are good. We waited the 2 years. Like, I know what to do now with like my nutrition and making sure I'm getting the food that I need and preparing and moving my body the way I want to. And so moved through that pregnancy, and I chose not to focus on like preparing for a VBAC. I had felt like I had enough experience just from my doula training and just being part of the birth world, that I'm like, I know enough that like I'm not going into this completely blind, and I don't want to hyper fixate on like all the different things that people might do to prepare. Like, I'm just going to have it in my mind that like this is going to happen. I'm going to go into spontaneous labor. I dilated to 10 the first time at 38 weeks. Like, I can do this. Like, I know my body can do this. I just need everything else from the outside to go well too. Unfortunately, towards the end of that pregnancy, my blood pressure did start to creep up. I'm gonna blame the fact that we are the crazy people that got a puppy in between having 2 kids. So we got a puppy, my service dog for diabetes. He passed away on his 10th birthday in November of 23. And then we got pregnant, I found out in March of 24. So we had got a dog in December, so he was only like a couple months old. And I just like, he was such a pain that I just feel like I was like gritting my teeth all the time, like so stressed out. And, but he, my baby was totally fine, nothing wrong with him, but my blood pressure started to creep up. So they were kind of keeping an eye on that. And I'm like, I'm just gonna go into labor on my own, it'll be fine. And luckily I did. I woke up one morning, I felt the contractions. I already had an MFM appointment that morning. And so I'm like, let's just head in. I probably would have labored at home a little longer, even though I know with a VBAC, maybe you're not supposed to do that. But I live 5 minutes from Social Hospital. I grew up in Weymouth, and that's where I live. So I'm like, I'm so close, like we're fine. So we went into the appointment though, and they're like, no, you're going to go into triage. Like, you're definitely in labor. Like, this is really happening. And it was only 12 hours from that first contraction that morning till when he came out. And that was great. But it was interesting just to see like the process of like how the system works within a VBAC. Because I hadn't actually supported a VBAC in person. I've supported people virtually with diabetes that are experiencing that. But a lot of the work I do is virtual. I don't get that chance to be with type 1s all the time in the Boston area, but they were doing a check at one point, and I heard that the doctor, who was one of the MFNs actually, he said something to the nurse about like passing him a hook. And I said, excuse me? Like he wasn't even gonna tell me. I heard him like whisper it under his breath. And I said, what are you talking about? And he's like, oh, we're just gonna break your water. And he's like, well, don't you want things to go quicker? I'm like, I've been here for 2 hours. Like,
also, don't you want things to happen with consent? Just
yeah. And I'm like, my husband's at home letting our dog out. I'm like, he's not even in the building right now. Like, can we not? Like, that's not, and it's just one of those things I'll stick in my back pocket. Like, now I've seen that happen in person, firsthand, in a situation where like it completely was not warranted in any way. And he's like one of the beloved MFMs, and my experience with him at appointments and stuff was always great. So that was a little disappointing, but it really, again, I'm like, I don't mind these things happening to me because it's a learning experience, and it's something that I can bring to the table with the work that I do. And so, things went well. Time to push. I pushed for less than half an hour, which was awesome. And I think the biggest concern that I had was pushing in a way that I was worried about my eyesight. And with my high blood pressure, I was on magnesium. So like there was like some issues with my eyesight from that. So I was a little bit worried, like, is something wrong like with my eyes? Like I think I was less worried about birth related complications and more worried about just like diabetes related things, which feels natural being someone who's lived with it for 20 plus years. So pushed, came out, it was great. Unfortunately, he ended up having low blood sugar. So I think some of the things that they did after he was born that caused him to be in the NICU and maybe even be there as long as he was something that could have been prevented if they had listened to me a little bit more. And so again, just like learning a lot through my own experience and learning how to be a better advocate for not just myself, but my children, and then also clients as I move forward with the work that I do. And I think the contrast between the two births, and I talk about this all the time, is I had the emergency C-section, which wasn't ideal and wasn't something that I wanted. And I do wish, like others have shared, that I had maybe prepared for that a little bit more. I really kept it out of my mind that was going to be something that I was going to experience. And I think one of the things that I'll bring up during some of my prenatal sessions too is I'm like, the thing that I look back on is, do you want the clear curtain or the curtain you can't see? And I'm like, I wish I was so scared when they were wheeling me down. I just wanted it to be done with, and I'm like, I don't want to see anything. But now looking back, I'm like, if I had really thought about all the things that might go into a C-section, that would probably be something that I would have done differently. It would have been, no, I want to see, like, it'll be fine, like, everything's going to be okay. But, his birth being a C-section and then having no NICU time versus having that really redemptive VBAC experience and then having, like, pardon my French, but the shit hit the fan after that, like it was really disappointing. And when I was brought to tears when you were talking about your son being taken away, because that was something that we were contending with. There was no room in the NICU, and they were going to take him. And I'm like, I gave birth at this hospital because I wanted to be with him. And like, I could have went anywhere, and I wanted to be here in my hometown near my toddler and like, there's no reason for him, like, he doesn't have these significant issues. It's a low blood sugar. We had a really great nurse who was like, let's bring him to pediatrics until there's a space for him. So he got to go to the PD ward for a little bit, which was nice. But just leaving him at the hospital and everything was really challenging. And but again, that experience really showed me, like, the birth itself can be wonderful, and then everything that happens afterwards can be hard. And I know I'm backtracking here a little bit, but another thing with the cesarean too, and being on fluids, and I think both experiences, both the C-section and then a VBAC with some NICU time, impacted my journey of lactation because of first my son that was first born being on fluids for so many days with an induction. His weight was inflated, and everyone was acting like he had lost so much weight when we were going to these pediatrician's appointments, and I was racked with all this guilt, like, am I not producing enough? And as a person who has an organ, my pancreas doesn't work, so I already have this doubt for myself that, like, something's wrong with me. I can't do these things the way that I'm supposed to do. I really felt like that significantly impacted my breastfeeding journey the first time, and then the second time being in the NICU, just thinking back to that first time, I'm like, I'll be damned if anyone thinks that I can't do this. Like, I did it before, I can do it again. He can come home, he knows how to feed, like, he's gonna be fine, blood sugars will be good. And so just kind of thinking about that too, of like how birth shaped postpartum for me as well, and how, as we know, like a cesarean birth is a birth just like any other, and a vaginal birth is great, and a VBAC is wonderful, but there is no better or worse. Like, it all comes with challenges. Some of them are similar, some of them are different, but sharing is helpful, and I appreciate this opportunity to be with you all.
Thank you for coming.